Hello, this is ESC TV live from London, and it's a pleasure for me, Rafael Vidal from Spain, to have here the Young Award in Thrombosis, Melgaard from Ralborg. So, which topic did you study?
Well, we assessed the TSVAS score in a heart failure population in sinus rhythm to see whether the TSVAS score was able to predict ischemic stroke in a heart failure population in sinus rhythm.
Okay, and how was the strategy to do this research?
Well, we used the Danish nationwide registries where in Denmark all persons have a unique personal identification number, which makes it able for us to kind of link data between these registries, and then we both found the diagnosis of heart failure and our endpoint of ischemic stroke.
I think this strategy in Denmark is really, you have to be proud of that, because it's amazing. You get a lot of info.
It gives a lot of opportunities.
Because that registers is true. What were your main findings in this study?
Well, we actually found that the TSVAS score was able to modestly predict ischemic stroke in heart failure patients in sinus rhythm with comparable accuracy as in patients with atrial fibrillation.
And when you check the TSVAS, which risk score did you find more predictive of stroke?
Well, yeah, we looked at the individual components of the TSVAS score, and we found that especially previous stroke was a very strong risk factor of recurrent stroke. And otherwise, age was a strong predictor, and it was only female sex in the TSVAS score who was not a predictor.
And ischemic heart disease, how it was there in this population?
Well, it was around, I think it was around 20% who had a previous myocardial infarction, and around 6% had a diagnosis of peripheral artery disease. So,
do you think it's important also to check maybe this in future studies? What do you think it's important to check?
Yeah, well, I think it is important because previous randomized controlled trials of heart failure patients, of whether they need anticoagulation therapy, kind of like did not show us some clear results. So I think it's important to find maybe subgroups within the heart failure population who might benefit from ischemic or from anticoagulation because of a high ischemic stroke risk.
And do you suspect which population it could be? This?
I have some guesses, and I'm actually right now looking into specific subgroups within the heart failure population. For example, patients with diabetes, patients with hypertension, and so on.
You have to summarize for the clinical for the clinical daily practice. What findings do you think are the most important?
Yeah, well, I think it's maybe not so surprising that the TSVAS score is able to predict ischemic stroke, but I think the most important is that the clinician have focus on the heart failure patient in sinus rhythm, because some of these patients might have an increased risk of stroke and might benefit from anticoagulation therapy. And that's important to have in mind when you see a heart failure patients.
Thank you for all your insights on your nice study. I think it's great study, and I think it deserves for sure this Young Award Thrombosis.
Thank you.